Ladies and gentlemen, greeting from Houston, Texas. It is a pleasure being with you virtually and present this talk about leveraging technology to manage Charcot foods from smart mat to smart socks and smart uploading. As a short introduction about myself, I'm Bijan Najafi. I'm serving as professor in the Department of Surgery at Baylor College of Medicine, and Director of Clinical Research at Division of Vascular Surgery and Endovascular Therapy, and co-director of National Science Foundation Center to Stream Healthcare in Place, or C2SHIP. I'm so grateful to the World Union Wound Healing Societies to give me the opportunity to be with you virtually and deliver this talk today. In the next 15 minutes, I would like to discuss some of recent innovations that could help to detect Charcot foot syndrome at early stage by detection of inflammatory syndrome. Dr. Jean-Martin Charcot, in his famous paper published in 1883, defined Charcot foot syndrome as an inflammatory syndrome characterized by varying degrees of bone, joint disorganization secondary to underlying neuropathy, trauma, and perturbations of bone metabolism. Therefore, for early detection of Charcot, it stands to reason that our focus should be on early detection of inflammatory syndrome. Because inflammatory is one of the earlier signs of Charcot, technology that can capture markers of inflammation may also assist in predicting joint deformity with sufficient lead time for effective intervention. Inflammation has 5 symptoms. The first symptom is dolor or pain, calor or heat, rubor or redness, tumor or swelling, and functional or loss of function. The most reliable measurement of inflammation, however, is based on thermography to measure heat, because simply this patient has neuropathy, they don't have pain, they don't feel pain. Often they have very low level of activity. Also swelling is prevalent, and redness because of the poor skin vision poor vision is very hard to detect. So the only measurement that remained to identify inflammation syndrome is by measuring heat. I divide the technology to measure heat as a sign of inflammation into 4 categories. The early method for measuring inflammation was based on measuring and comparing foot temperature between 2 identical spots at right and left foot. If the difference in temperature was greater than 2 degrees Celsius, then it's considered as inflammation. Dr. Lavery and Dr. Armstrong suggested this solution by using a temperature measuring device called TempTouch. The problem, however, of this method is that it was rely on patient to do the temperature measurement on several spots on the right and left foot, and then estimate the change in temperature. That may not be necessarily practical for these patient population. Later on, thanks to advances in infrared technology and image processing technique, the thermography imaging system, it's emerged and became popular. Based on signal processing and artificial intelligence, how the spot could be quickly identified. However, still this solution is limited to research and in clinic use, because either the technology still is too technology for home-based application, or patient may not be able to capture an accurate measurement of foot temperature using this device. Of course, there are some additional improvements using Alexa that may make easier for patient to capture foot temperature and share the data with the doctors, but that might be down the road. With emerging of remote patient monitoring and Internet of Things, or IoT, more practical solution for home use has been emerged. Here in this picture, I'm showing a smart mat that I will explain in a minute with detail that simply required that patient stand on it for 20 seconds to capture hotspot and identify inflammation syndrome. Other promising development in the field is wearable technology like a smart socks that again I will explain in a minute. These technology also enable us to measure additional metrics that may improve the accuracy of detection of inflammation syndrome, and this is thermal stress response. That means that not only measure the hot spot, also it detects the abnormal change of the foot temperature response to repetitive stress like walking. Here is an example of remote patient monitoring of inflammatory syndrome using smart mat. Patient just needs to stand on the mat for 20 seconds, as it's shown in this picture on the left side, and then the device automatically detects inflammation sign. We explore the acceptability and validity of these concepts to predict diabetic foot syndromes. The method summarized in the middle picture. So we recruited 129 patients with history of diabetic foot ulcer and followed them for 34 weeks. We identify 53 reoccurrence of foot ulcer, and then we detected that whether the detection of inflammation can predict that foot ulcer, and we find out that the device based on threshold of 2.22 degrees Celsius can detect reoccurrence of foot ulcer with sensitivity of 97% and 37 days lead time on average. And this is sufficient time window for providing timely intervention. Another promising results were that the adherence of daily using of this mat was pretty good. It was 86%. Of course, the only downside that we find out is that the false alert rate was relatively high. It specifically was 57%. That it might be okay if we are using this technology for triaging and coaching patients to prevent, for instance, Charcot foot syndrome. To address high false positive rate of a smart mat, probably we can use complementary information by continuous monitoring of foot temperature during activities of daily living. Instead of having a snapshot of temperature during 20 seconds that offered by a smart mat. This technique is known as thermal stress response and suggested by our team for early detection of Charcot foot syndromes. And in this technique, we measure the changes of foot temperature in response to walking to identify the inflammation syndrome. In our study that's summarized in this slide, we recruited 14 patients with Charcot foot syndrome and 18 age-matched non-Charcot foot syndrome but with diabetic peripheral neuropathy condition. We asked the patient to walk at their regular speed using their prescribed footwear for average of 200 steps. And then using thermography, we look at the profile of the change of the temperature as a functional number of the steps that you can see on the right picture. What we observe is that in both group on the earliest steps, we have a slight reduction in temperature, probably because of the hyperthermia effect and acclimatization during early step walking. But then the difference, it can be observed after a step of 20 that in Charcot foot, we saw a sharp increase in temperature, while the increase in temperature in the control group was not necessarily noticeable. We interpreted or speculated that this sharp increase might be because of abnormal inflammation or may identify inflammation syndrome. Later on, we proposed the concept of smart socks based off this smart textile. This technology that originally designed based off the fiber optic enables us to not only measure temperature, but also measuring pressure measuring thermal stress response, measuring shear, as well as the subtle joint angles. In our studies, actually, we validated these technology against of gold standard, and we suggested as a practical tool to monitor remotely. Later on, there are several companies that they came up with a similar concept, and even with simpler form factor. This is an example of one of those technology designed by a company named Siren Care that's coming with a companion app. The technology enables to continuously monitor temperature, and as illustrated on the right picture, it can show the change of the temperature over time and can identify maybe inflammatory syndromes. Of course, I'm not aware about yet the study to confirm that this is inflammatory syndromes or can help to prevent foot ulcer or joint deformity. So, but it's a promising step forward in this area. Another innovation in the field is recent advances in the offloading modality that is probably one of the most effective solutions to manage inflammation syndrome and prevent joint deformity in Charcot patients. As you probably know, a major challenge that usually we have with the use of offloading is that patient often doesn't have a good compliance to this offloading, because this is daily life commitment. And another problem is that we are not sure that whether a patient reduce their level of activity when they have inflammation syndrome. To address these gaps, we came up with the idea of the smart offloading that simply is required to have an inertial sensor that here is shown on the left picture on the top. We snap that sensor on the offloading. The job of this sensor is twofold. First, it detects that whether patient, when they are walking, whether they are walking with their offloading. And the second task is using a smartwatch that it has some gamification feature to actually better engage patient, reinforce adherence to the offloading, also notify or monitor the number of taken steps per day. Another key innovation of this technology that illustrated in the middle picture is creating a very simple, comprehensive remote patient monitoring portal that can empower doctors to remotely triage those patients who may not have a good compliance to the offloading. Additionally, it can help them to understand that how many steps per day they are walking with offloading as well as without offloading. And this information may be used for educating patient and adherence reinforcement. We recently published earlier results and acceptability of this technology as well as accuracy of the system to detect compliance to the offloading as well as measuring the number of steps. We also initiated a randomized controlled clinical trial that evaluating the effectiveness of this technique to improve wound healing and maybe down the road to manage the Charcot syndromes. So as a summary, during my, or this take-home message that I would like to highlight during my talk is that temperature is a surrogate marker for inflammation. And there are now many different technologies that enable us to measure temperature, from thermography to smart mats, and those may help to, in particular from remote patient monitoring modality, enable us to maybe capture early sign of inflammation or Charcot foot. Another promising development in the field is the wearable technology that not only can identify the hottest spot, also can measure thermal stress response, thus reducing maybe false positive rate for detection of inflammation syndrome. And lastly, I try to highlight that there's some of the very promising development in area of the telehealth, wearable technology and remote patient monitoring system have been emerged that it may empower patients and their caregivers to better engage in self-care, as well as empower doctors to provide personalized care. They are still in infancy stage, but it's very promising results coming in the recent literature. To that end, I must acknowledge my team. This is a picture of my team just before pandemic. I would like to also thank you for listening to my talk. Please feel free to send me an email if you have any question. You can see my email address on this slide. Also, I will check the portal of the conference for any question posed during my talk, and we do my best to address them in a timely manner. Thank you again, and enjoy the rest of the conference.